My name is Chloe Hall and I am 18. Ever since I was born, I have been experiencing medical issues. I was born with a genetic disorder from my mother called Marfan Syndrome. My brother and mother also have the syndrome. Marfan Syndrome affects the entire body, especially the heart and the eyes, as it is a connective tissue disorder. Marfan Syndrome has greatly affected my life. I wasn't allowed to participate in PE or sports as a child. I was always tall for my age, often being mistaken for someone much older than I was. I had even been kicked out of the mall's play area when I was 5 because I was too big. I was bullied a lot due to my height, crowded teeth, lisp, the way I walked, and because I couldn't participate in the activities the other kids could. I was always sitting on the sidelines during any PE or sports event at my school. I began taking dance classes when I was 3 years old. Dance was the only sport-like thing I could do, and it made me feel at least a little normal. However, I was bullied at dance too and had to get special costumes due to my size. Despite all of this, dance was something I genuinely enjoyed. However, that all changed by the time I was 10 years old. I wasn't able to move up with the other girls my age due to the physical activity increasing. At age 12, my cardiologist told me that my aorta was too enlarged to safely continue dancing and I had to quit. I was back to being on the sidelines again. Due to this, I deliberately opted to attend the middle and high school that didn't focus so much on sports. However, my physical and cardiovascular health still declined due to Marfan Syndrome. The lenses in my eyes dislocated and I had to go through 2 eye surgeries to fix them. I also had a retinal detachment due to my Marfan Syndrome and had to get surgery to fix that. I had almost lost the vision in my left eye completely. However, the scariest thing that happened to me due to this genetic condition occurred on December 9th, 2017. I had woken up early in the morning due to an excruciating pain in my chest. My dad thought it was just an asthma attack and told me to take a puff of my inhaler and go back to bed. When that didn't work, my mom woke up and told my dad to take me to the hospital. Luckily, he listened. On arriving at the emergency room, none of the nurses or doctors knew much about Marfan Syndrome. I had told them that my aorta was enlarged, however they didn't think that it could be an aortic dissection due to my age. They tried to tell me it was gastric reflux and tried to send me home. Luckily, my dad had refused to leave until they called my cardiologist, and luckily, she had already arrived at work. My cardiologist knew a lot about Marfan Syndrome, and while knowing that it was extremely unlikely that a 15-year-old would be having an aortic dissection due to Marfan Syndrome, still ordered that the emergency room doctors perform a CT scan. It was then confirmed that I was, in fact, having an aortic dissection. I was rushed to Levine's Children's Hospital and taken into emergency surgery. My surgery had many complications, and the doctors claimed that if I had arrived even 5 minutes later, I would have died. I went through 2 long weeks of recovery in the hospital, 1 week being spent in the ICU due to multiple complications occurring during recovery. It then took me months at home to fully recover. While I am fully recovered now and have a replacement aorta, due to my Marfan Syndrome, it is very likely that I will have to have open heart surgery again within 10 years to repair any damage the condition caused to the new valve. However, this was only my experience with Marfan Syndrome. Which begs the bigger question, what exactly is Marfan Syndrome? Marfan Syndrome is a rare genetic disorder that was discovered in 1896 with one cause, a plethora of symptoms that range from mild to severe and very few treatments. Marfan Syndrome was discovered in 1896. While 1896 seems like quite a long time ago, it's really not when it comes to diseases and disorders. With saying this, Marfan Syndrome is a fairly new disorder. Furthermore, due to the rarity of this disorder, not many people know of it. Due to Marfan Syndrome's rarity and complexity, there are not many treatment options available for people with this disease. So what exactly is Marfan Syndrome? Marfan Syndrome is a connective tissue disorder. A connective tissue disease is any disease that affects the parts of the body that connect the structures of the body together. Connective tissue is made up of 2 types of proteins, collagen and elastin. Collagen is found in the tendons, ligaments, skin, cornea, cartilage, bone, and blood vessels. Meanwhile, elastin is a stretchy protein that resembles a rubber band and is a major component of ligaments and skin. Basically, connective tissue disorders occur when collagen and elastin are inflamed. There are over 200 types of connective tissue disorders, such as rheumatoid arthritis, lupus, and of course, Marfan Syndrome. All connective tissue disorders are different and can be caused by different things. Connective tissue disorders can be caused by environmental factors such as exposure to toxic chemicals, exposure to ultraviolet light, bad nutrition, and infections. However, they can also be caused by genetics, which is the case with Marfan Syndrome. Marfan syndrome is a rare connective tissue disorder caused by genetics. Marfan syndrome has an autosomal dominant inheritance. Autosomal means that the disorder occurs on one of the autosomes instead of sex chromosomes. This means that men and women have the same chance of inheriting Marfan syndrome. Dominant means that only one gene from one parent is necessary to pass down a trait or a disorder. In other words, someone who is heterozygous for the Marfan syndrome gene will present with Marfan syndrome. Punnett squares and pedigrees are great ways to show the pattern of inheritance for a disorder. Due to the trait for Marfan syndrome being the dominant gene, the Marfan syndrome allele will be represented with two capital M's in the Punnett square. Absence of the Marfan syndrome gene will be represented by two lowercase m's, and the heterozygous person with Marfan syndrome will be represented as uppercase M, lowercase m. Let us start with the more simple patterns of inheritance. Let's say that two people with Marfan syndrome reproduce. This would not be likely because despite this disorder being dominant, it is still very rare with fewer than 200,000 US cases per year. That being said, let's say it did happen. These two parents and their offspring would be represented by the red Punnett square. This shows that the offspring have a 100% chance of all being homozygous and presenting the Marfan trait. Furthermore, a pedigree showing this inheritance could look like this, where the black represents someone who is homozygous for the Marfan trait, the gray represents someone who is heterozygous for the Marfan trait, and the white represents someone who is unaffected by the Marfan trait. Furthermore, the square represents male members of the family, and circles represent females. Moving on, two parents who do not have Marfan syndrome will most likely not produce offspring with Marfan syndrome. The only way for a family with no history of Marfan syndrome to have children with Marfan syndrome is through gene mutation. If one parent is homozygous for Marfan syndrome and the other is unaffected, all of the offspring will be heterozygous for the trait. This means that the offspring will have Marfan syndrome, but only have a 50% chance of passing the gene on if they reproduce with someone unaffected by Marfan syndrome. If someone who is a homozygous for the Marfan gene and someone who is heterozygous for it reproduce, all children will have Marfan syndrome. However, odds are 50-50 whether or not the offspring will be homozygous or heterozygous. Lastly, if two heterozygous people with Marfan syndrome gene reproduce, the outcome of the offspring will present a 1-to-1 ratio, where there is a 50% of having a heterozygous offspring, 25% of chance of having a homozygous offspring, and 25% chance of having an offspring unaffected by Marfan syndrome. Statistically, Marfan syndrome occurs in 1 in 5,000 live births. Due to this rarity, there are very few resources available. According to the Marfan Foundation, fibrillin-1 is the protein that plays a part in Marfan syndrome, making it a connective tissue disorder. Marfan syndrome is caused by a defect in the gene that tells the body how to make fibrillin-1. The defect causes an increase in the protein known as transforming growth factor beta, which in turn causes problems in connective tissues throughout the body. What symptoms and complications come along with Marfan syndrome? Marfan syndrome has many symptoms. According to the National Institute of Health, the signs and symptoms of Marfan syndrome vary widely in severity, timing of onset, and rate of progression. Furthermore, people with Marfan syndrome have a very specific look to them. Typically, people with Marfan syndrome are tall and lanky with abnormally long, flexible appendages. For example, fingers and toes are long and can bend in strange ways. Toes are often described to be finger-like, and the arm span of someone with Marfan syndrome often exceeds the length of their body. Furthermore, Marfan syndrome have very thin skin due to their height, often leading to stretch marks. People with Marfan syndrome typically also have a long, narrow face. Many people with Marfan syndrome have overcrowded teeth. Their chest is also often either protruding or sunken in. While these physical symptoms do not seem very severe, they can lead to pain. Most people with Marfan syndrome have scoliosis, causing moderate or to extreme pain in their back. They also generally have flat feet, which leads to increasing pain throughout the day while walking. Marfan syndrome greatly affects the eyes as well. Many people with Marfan syndrome have bad eyesight and are commonly nearsighted, and many suffer from disconnected lenses, causing a blurry vision. Furthermore, people with Marfan syndrome have a greater risk for having a retinal detachment, experiencing cataracts and glaucoma in adulthood. Marfan syndrome also has an effect on the mouth. As stated before, people with Marfans also have overcrowded teeth along with either an underbite or overbite. Furthermore, children often have a difficult time losing their baby teeth and growing adult teeth. The most severe complications associated with Marfan syndrome come from cardiac abnormalities. It is important to know that Marfan syndrome most commonly affects the aorta. People with Marfan syndrome can experience shortness of breath, fatigue, and heart palpitations due to leaks in valves that control blood flow throughout the heart. These leaks can cause the aorta to weaken and stretch, leading to a bulge in the blood vessel wall. This is known as an aortic aneurysm. Furthermore, the increased size of the aorta can cause a sudden tear of the aortic wall, known as a dissection, which is often fatal. So what are the available treatment options for Marfan syndrome? As stated before, the rarity and complexity of Marfan syndrome causes there to be very few treatment options and no cure. According to the National Heart, Lung, and Blood Institute, current treatments for Marfan syndrome only help to delay or prevent complications. Here are the most common preemptive treatment options. Having a preemptive aortic valve replacement to reduce the risk for a sudden fatal aortic dissection or aneurysm. Getting braces to help with the overcrowding of the teeth. Having lens surgery to improve eyesight, and taking blood pressure medication or blood thinners to reduce the risk of an aortic aneurysm or dissection. It is important for treatment to be started as early as possible to prevent future complications.
Phil Parker Hall, 21 years old.
Hall, 24.
Henry Hall, age 46.
Do you have Marfan syndrome?
Yes, I do.
Yes.
Do you know someone with Marfan syndrome?
Yes, my wife, my two kids, Caleb and Chloe, or my wife's mother, Debbie, and my wife's sister.
Marfan syndrome is a connective tissue disorder. It affects your joints, it affects all the connective tissues in your body, and then your heart, your eyes.
It's a genetic disorder that affects the connective tissues of the body.
Connective tissue disorder mostly affects the heart and joints.
Diagnosed with Marfan syndrome.
I was 2.
I don't even think I was 1 yet. Mom knew that she had it unless she had us tested.
I was dating my wife when before we got married, and she kind of explained that she had genetic disorder and what it kind of did. At the time, I pretty much thought that it only dealt with, somebody's eyes, because that tended to be the issue that she had the most. But come to find out, it can affect people's hearts and other connective tissues of their body.
I was not allowed to participate in any type of sports or gym class activities. I had to go to the cardiologist once a year, which was, of course, unusual for a child. My eyesight was horribly bad because I was born with dislocated lenses and cataracts on my eyes, and until I was 18, I was legally blind, at which point I had a retinal detachment. At that point, they were able to remove the lenses from my eyes, which allowed me to actually have 20/20 vision for the first time in my life, which was fantastic.
First, not much. Early years, not much. The heart wasn't bad, so I could still do sports. I played soccer. I did stuff out on the playground. And everything was normal. I think the first time it really affected me was when they had to pull me off the soccer team because of it.
My wife and my kids they all have Marfan syndrome, so there's been a lot more doctor's visits and a lot more, upkeep just to make sure that they're staying healthy overall with the condition pretty much since birth for my kids and since I've known my wife.
Well, of course, I couldn't see very well, so I was very self-conscious about going into social situations. If I wasn't familiar with the surroundings, was I going to be able to adapt? It was embarrassing in school because I could not see the yellow chalk on the green chalkboards, and a lot of the teachers did not understand that. that. They thought it was just a distance thing. And so several times I was embarrassed in front of the whole class. My teacher was putting my desk right up against the chalkboard because I couldn't see. I had to, finally when I was in high school, I had a teacher who was very sympathetic to the whole situation and was able to get my school books in Braille or large print, whichever worked better for me. And I went through a lot of my life, especially like in reading class, memorizing the reading passages in case I got called on in class, so I wouldn't be embarrassed by having to hold the book up to my face like this. You learn a lot of adaptive behaviors to kind of try to fit in when you're, a teenager. You want to be like everybody else.
Earlier on, it was just like, oh, you can't play sports, right? You can't do a lot of stuff the other kids are doing. And then even like still today, where most of my friends even don't like sports, they're not sports people, they're not really physical people, they still like to go hiking, and I gotta tell them, hey, I'm not gonna really be able to do that. They like to, one of my friend's birthday, they wanted to go to a trampoline park. I went, but afterwards I suffered for a couple days of just terrible back pain.
Well, I have to continuously go to the cardiologist, make sure that I'm being followed, make sure I'm taking medications to help slow down the progression of the aortic enlargement. I did have an aortic dissection, which should have been fatal, but thankfully it was not. My body somehow sealed itself off from that. And then, of course, I continue with eye situations, retinal detachments. The more retinal detachments you have, the higher risk of losing your eyesight is. Also, I've had several issues with my lenses falling out and dislocating again. So that's something that I will continue to struggle with for the rest of my life. And just also having children and knowing now how it really does severely affect your life, I probably would not have chosen to have children naturally.
Well, I constantly have back pain because of the scoliosis caused by Marfan Syndrome. I'm not allowed to participate in physical activities. Just walking tires me out. And I think that's really just back pain, but the back pain is an offshoot of the Marfan Syndrome. I've had 3 back surgeries, a leg surgery, foot surgery, several eye surgeries. All this stuff is caused by Marfan's.
Knowledge about, genetic issues increases. When people have an increased knowledge about it, it kind of helps funding for any potential research or things along those lines that you may not otherwise get.
I think it helps, especially considering I had 2 children. Both of my children have Marfan Syndrome. My mother had 3 children, and 2 out of her 3 children had it. My sister had 3 children. 2 out of 3 of her children have it. I think knowing how prevalent it's spread and how it really affects quality of life, I think it allows people to make better decisions as far as their healthcare goes and as far as what they want in their future. I think it allows people to understand that, okay, this is a condition that you may look like you're fine on the outside, but it actually really affects, it can affect your self-esteem. It can affect the way you interact with other people. It can cause a lot of anxiety because the risk of an aortic dissection is high, and it most often times is fatal. So I think just by spreading awareness and allowing people, there's been a lot of people in sports who didn't know they had Marfan Syndrome and dropped dead of a aortic dissection because they just didn't know. So I think that knowing what this condition is and what to look for will cause those who have gone undiagnosed to hopefully be diagnosed and be able to take the proper steps in ensuring that they live a longer life.